Hello.
How you doing, John? My
How
name's
you doing?
Jeremy. I'm going to be your nurse today. We got to go through some questions. I'm going to shut the door here to ensure privacy. Wash my hands. So, could you tell me your name, please?
My name is John Peterson.
And your phone number?
989-333309.
Address?
15131 Bay City.
And your birthday?
August 4, 71.
And your birthplace?
Bay City, Michigan.
And how old are you?
25.
And are you married, single, divorced?
Married.
And your occupation, what do you do for a living?
I'm a plumber.
Who's your employer?
I'm self-employed.
And what brings you in today?
I just came from my annual checkup. Yeah, pretty much.
So just your annual checkup, and
Yeah.
you don't have any complaints for us today?
Some allergies, I have seasonal allergies.
Okay. And do you have any past illnesses, history of illnesses?
Yeah, I had pneumonia when I was 5.
And do you have any problems from that pneumonia?
Not now, now I'm okay.
Okay. And how would you describe your general health, your overall health?
Now I'm alright.
Okay. And you said you had pneumonia as a child, you were
Yes.
5. Any other illnesses when you were a child?
No, not
Okay.
at all.
Any accidents or injuries?
No,
Any serious or chronic illnesses?
no.
Did you stay in the hospital for the pneumonia?
Yes, for a week, I'm told.
Okay. Have you ever been in the hospital for any other?
No.
And where was that hospital stay for the pneumonia?
Saginaw. St. Mary's.
Okay. Ever had any operations?
No.
Okay.
The circumcision operation?
What's that?
You call circumcision operation?
We'll put that down here. And are you up to date on your immunizations?
Yes, I just had my flu last week.
Flu shots, you got your Hep B and your
Yes.
measles, mumps, rubella. And when was your last exam date?
Last year pretty much the same time, okay.
Okay. You said you had seasonal allergies. Any other allergies?
No.
Okay. And what's your reaction to the seasonal allergies? What happens?
Sometimes I have hives and I sneeze a lot. My eyes become watery.
Any congestion,
Yes.
cough?
Yes.
Okay. Are you currently taking any medications, over the counter or prescription?
No, just over the counter Tylenol.
Okay, Tylenol. You're not taking anything for the seasonal allergies?
Usually I do Benadryl or Claritin.
Okay, and you said you're having some trouble with your seasonal allergies
Yes.
recently. Are you taking any of that right now?
But now,
Okay. Do you have any family history of heart disease,
no.
high blood pressure,
No.
stroke,
My grandpa had a stroke.
diabetes,
No.
blood disorders,
My grandpa had leukemia.
okay, breast or ovarian cancer,
No.
okay, and you said your grandpa had leukemia. Any other cancers?
No.
Okay. Sickle cell?
No.
Arthritis?
No.
And you said you have allergies. Any family history of allergies? Anyone else in the family have trouble?
No.
Any family history of asthma?
No.
And you don't have asthma, correct?
No.
Okay. Any family history of obesity?
No.
Alcoholism or drug addiction?
No.
Okay. Mental illness?
No.
Suicide?
No.
Seizure disorders? Epilepsy or anything like that?
No.
Kidney disease?
No.
Tuberculosis?
No.
You have any present weight gain, loss, or anything like that? No, nothing like that. You're not doing any special diets to try to lose weight or anything?
I guess eat only once a day.
Okay. And are you fatigued at all? Have any weakness or malice?
No.
Fever, chills, sweats, or night sweats?
No.
All right. Do you have any skin disorders? You said you get hives from your seasonal allergies.
Yeah.
Anything else? You got eczema, psoriasis?
No, I don't have
Any pigment change?
no.
Except, is your skin really dry?
No.
You gotta use a lot of lotion? Any bruising? Have you had any recent hair loss or change in your hair texture?
Yeah, I'm losing hair.
Has it been recent or just over time?
Over time.
Okay.
Around the family.
Okay.
And another side.
And can I see your nails? How often are you out in the sun?
Pretty much every day.
Okay. And do you use any sunblock or anything like that?
I don't with my skin.
Okay. You know, even though you don't get sunburned, you should still probably use sunblock to help you out with the sun exposure. Do you have any unusual headaches,
No.
head injuries, dizziness, vertigo? Vertigo is when you're dizzy.
No.
You have difficulty with your vision. I see you wear glasses.
Yeah, I'll be able to read.
For reading?
Yeah.
And other than that, you don't have any difficulty with your vision? Okay. Any earaches,
But now.
ear infections, discharge? You say not now, you've had earaches in the past?
Yeah, sometimes it's.
Okay, were they chronic or they popped up every
We
once in
just
a while?
popped out when we were shooting.
Okay. You have any hearing loss, any trouble hearing? Okay. And you said you're congested from the seasonal allergies. Do you have like discharge and?
Yeah, kind of water discharge when I'm stucky.
Okay. And what's it? If you say it's watery, what color is it?
Clear white.
Okay. Do you have frequent colds?
Not really.
Does your sinuses cause you any pain?
Sometimes I have headaches.
Okay. And nasal obstruction, can you breathe out of your nose or does it plug up pretty?
It plug up pretty good.
Okay. Do you experience any nosebleeds?
No.
Does it change your sense of smell?
I'm not doing this right.
Okay. Are you currently having any mouth pain, sore throats, bleeding gums, toothaches? Any lesions in your mouth or on your tongue? Any trouble swallowing? Any hoarseness, like your voice changing? Do you still have your tonsils or were your tonsils removed?
No, it's never.
Okay. Any change in your taste?
No,
And when was your last dental checkup?
2 weeks ago.
Okay.
Earlier.
And do you have any pain in your neck?
No.
Any limitation in your motion of your neck?
No.
Do you feel any lumps, swelling, or anything in your neck?
No.
And your breast, do you have any discharge, any lumps in your breast?
No.
Any history of breast disease?
No.
And you said you didn't have any surgeries other than the circumcision. Any tenderness in your armpits?
No.
Rash in your armpits? Lumps? No troubles moving your arms around with that area?
No, nothing more than part-time.
And do you perform a breast exam? Has anyone ever talked to you about performing a breast exam?
No, I haven't done this. Do I need to do this?
Well, you know, once a month, you should, even though we're males, you should perform a breast exam, but we'll go over that later in the, in our physical examination. I'll show you how to do that. Okay? Do you have any respiratory history of lung disease, respiratory problems like asthma?
No, I don't.
Bronchitis? You said you had pneumonia when you were 5. No TB. No chest pain when you're breathing? Wheezing or noises when you're breathing? Okay. You ever, when was your last chest x-ray?
I think 2 years ago.
Okay.
Like this kind of.
Okay. You have any chest pain?
No.
Heart palpitations?
No.
Any history of a heart murmur or hypertension?
No.
Coronary artery disease? And you said you didn't have anemia. Have you ever had an ECG?
No.
Do you have any coldness, numbness, or tingling in your fingers or your feet, toes?
No.
Swelling of your legs?
No.
Discoloration in your hands or feet?
No.
No varicose veins, complications? No ulcers? You said you're a plumber, so you don't spend a lot of time sitting or standing. You're under houses and stuff like that. Yeah. You're moving around quite a bit though, right?
Yes, I do.
Okay. And how's your appetite?
It's pretty good.
Do you have any foods that you just can't eat, like you have a reaction from, or you just
No, I
can't?
really don't want to.
Okay. No trouble swallowing, no trouble with heartburn, indigestion. You have regular bowel movements
Yes, I do every day.
every day? How often per day?
No, once.
Okay. Then you don't have any blood in your stool or anything like that, no rectal bleeding? Okay, you don't use any antacids or laxatives?
No.
Okay. And do you have any trouble when you pee?
No, I'm pretty good.
Okay, how's the frequency of your are you peeing all the time? You don't pee very often?
I pee on probably more than once a day. I think a lot of fluid, so that makes me pee.
Okay. Do you get up in the middle of the night having to pee?
Maybe once.
And what's the color of your urine?
Pee kind of yellowish,
Okay.
odorless.
And when you start to pee, do you ever have to strain to pee, or
No.
and the stream is constant?
Yes.
Okay. And there's no history of urinary disease in your family?
No.
Or for yourself? Do you have any pain in your back, like lower back on the sides?
No, maybe just from bending for a long time.
Okay. No pain in your groin? Do you have a history of any UTIs as a child?
No.
Do you have any pains in your male genitalia, your penis or your testicles?
No.
Any sores or lesions down there?
No.
Any discharge from your penis?
No.
no lumps or hernias down there.
No.
Have you ever performed a testicular exam?
Yeah, I was told that I need to do it at least every week.
Every week?
Yes.
And where do you do that at?
Say sometimes in the shower. So I usually do it in the shower.
Okay, do you understand why you're to do it in the shower?
It's just said I should check my toilet, so I do that.
Okay, you do it in there because you gotta stay warm so that the testicles are, loose and away from your body, so you can really feel the consistency there. But that's good that you're doing it, and we'll go over that more in the physical exam too. You said you're married?
Yes.
Okay, and, there's nobody else there, are you having intercourse with anyone else but your wife? How regular is, your relations with
Once
your
a
wife?
week.
Okay. And do you use any protection when you're having sex with your wife?
Yeah, she's on contraceptive.
Okay, she's on birth control?
Yes.
Oral birth control?
Yes.
Okay. Have you had any, have either one of you had any history of, STDs?
No.
Have you had any experiences with arthritis or gout?
No.
How much walking do you do a day?
I run every day at least a mile or two.
Okay. And then you're walking all the time for work with the phone? Is there any effect on your range of motion or daily activities? You're able to shower and get dressed and feed yourself and all that stuff. You don't need any mobility aids, correct?
Yes.
You do need mobility aids, or you?
No, no,
Okay. And do you have a history of seizures,
no.
stroke,
No.
fainting, blackouts? Do you have any problems with bleeding? Do you bleed excessively, bruise easily?